All right, so today, as I mentioned, I think you guys just rebranded, right? So it's not It's Time Texas, it's Yes. Okay, that's awesome. I love that new name change, actually. So we have people from Healthier Texas, formerly It's Time Texas, here with us today. So this is their third installment of our webinar series with them. So we're happy to have them. So Andrea Rosario is the Senior Director of Health and Civic and Education for Healthier Texas, the nonprofit creating a Healthier Texas through a focus on health prevention. With more than 15 years of experience in public health, her work spans health curricula creation, program development and management, and advocacy. At Healthier Texas, she oversees the development of community-informed and evidence-based health and civic education programs, ensuring that they impact Texans' health in meaningful ways. A social and reproductive justice advocate, Andrea serves on the board of Health Literacy Texas and Healing Hands Community Doula Project. So welcome to Andrea. And for Vanessa, she is a skilled project leader, relationship manager, and public health professional with an educational background in sociology and community nutrition. She's worked in the health sector for about 13 years and has focused on public health and community engagement in Texas for the past 8 years. Vanessa currently works as the Senior Director of Capacity Building at Healthier Texas, overseeing the organization's school health initiatives and regional efforts. So thank you both for joining us today. I'll go ahead and turn it over to you.
Thank you. I'll go ahead and share the screen. So welcome everyone. Thank you for joining us on today's webinar, Empowering Schools to Revolutionize Recess. Just a few housekeeping rules. We'll have a Q&A at the end of the presentation, so please use your chat function to ask any questions during this presentation, and we'll make sure to answer as many as we can. There we go. This is a reminder that Healthier Texas is funded by SNAP-Ed. And so as Shelby, thankfully, and thank you so much for introducing us. Your presenters today, of course, will be Vanessa Castro and myself, Andrea Rosario. So Healthier Texas is a statewide nonprofit working to bring people, organizations, and communities together to take action that supports health for all, now and for generations to come. We believe where you live should not determine how long you live, and that's why we're working to reduce the risk of preventable diseases while increasing access to health for all Texans. During our time together, we'll explore the role of Healthier Texas in supporting schools across the state. We're not just here to talk about change, we're here to make it happen. And so we'll learn about how we partner with schools to implement real, lasting policy systems and environmental change that create healthier environments for our kids. Next, we'll tackle the nitty-gritty of PSC change in schools. So change isn't always easy, and we'll look at the roadblocks schools often encounter when trying to improve their health policies, but also uncover the opportunities that exist. And lastly, we'll put our evaluation hat on, and we'll examine the powerful framework called the whole school, whole community, and whole child model. So I know that's a mouthful, but you'll see how this model has really been a game changer in promoting healthier school environments, and we'll discuss the practical ways to apply this model to your work. And so by the end of the session, we're really hoping that we can provide you with some really great insights and strategies to really champion healthier schools throughout the state. And so when you think of the word recess, what comes to your mind? I want us to just kind of sit for a second and think about when we were kids in schools and what that really meant to us, the recess time. And for many of us, it does bring back memories of running around on the playground, laughing with friends, or maybe even, the time when we mastered the monkey bars or that flipper over the swing. But recess is so much more than just a break from class. We define recess here at Healthier Texas and across the state as daily unstructured outdoor play provided to students, during the school day. It's that crucial time when kids can move, when they can explore, and they can just be kids. But here's a little bit more. Texas right now currently has no requirement for recess. And so let's just really think about what that can mean for kids in generations to come if there's no policies set in place for recess. And so while there's an importance on district-wide written policy, we really want to emphasize that lasting change. So we realize that policies are not just a piece of paper. It's really a commitment to children's well-being. It ensures that all students, regardless of their school or background, they receive that vital opportunity every day. So by implementing a solid recess policy, we're not just adding playtime to a school day. We're really investing in our children's physical health, their mental well-being, and their future success. It isn't a luxury, and it's not, and it should not be an afterthought. So it's a necessity, and it's a powerful tool to really have in schools, in communities that create healthier and happier and more well-rounded students. So here we realize that there are tons of benefits to recess. I know in our research, especially as health educators and promoting this, we understand some of these benefits, but let's kind of walk through them a little. And so we know that recess provides an excellent opportunity for moderate and vigorous physical activity. And during recess, kids run, they jump, they climb, they play, and they have fun. And this type of activity is really essential for the motor skills. It improves cardiovascular health and it maintains a healthy weight. This is particularly important since Texas ranks 9th highest in the United States for childhood obesity. Unstructured playtime is vital for cognitive development. When children are allowed their own time and space during recess, they have to come up with games. They have to resolve conflicts and navigate social situations on their own. This free time strengthens imagination and creativity, and it helps develop critical thinking skills. It's like a mental reset button, allowing children to return to class refreshed and ready to learn. And recess also provides opportunity for relationship building and promotes empathy and cooperation. So on the playground, children learn to take turns, they share equipment, work together in games. They practice important social skills like communication, negotiation, and conflict resolution. These interactions help children develop emotional intelligence, build friendships, and learn to understand and respect others' feelings. And so for many children, the social learning that happens during recess is just as important as the academic learning that happens in the classroom. So recess, like I said before, it's not just a break from learning. It's a different kind of learning that complements and enhance classroom instruction. So you might be wondering, how do these benefits really translate to the classroom? Well, thanks to some research done by Texas Christian University, they provided some really great insights into what this looks like inside the classroom. And so there were 3 key findings that were demonstrated that really impact classroom environments and their performance and academic achievement. And so the first is a 40% reduction in off-task behavior. And so that's significant in that, let's think about this, after recess, children, they're more focused and they're more ready to learn. They've had a chance to expend that energy, socialize, and reset their minds. And this means teachers spend less time managing behavior and more time teaching. Secondly, 67% of recess is focused on midline crossing physical activities. And so these are activities that really require coordination between the left and right sides of the brain and the body. This type of movement is really critical for cognitive development and enhanced learning readiness. It's like a full body brain warm-up that prepares students for the classroom. Lastly, and perhaps the most impressive is by 4th grade, students who had regular quality recess time showed 10% higher scores on standardized tests. This is a clear indication that the benefits of recess aren't just about having fun and staying physically active. They directly contribute to the academic performance of a student. So as we've discussed, there are numerous benefits to recess, and it's important to acknowledge that not all students have equal access to quality recess time. And there's clearly barriers to equitable access and strategies we can implement to promote inclusivity. So first is the socioeconomic disparities. Schools in lower income and even more rural areas often have less funding for playground equipment or may lack safe outdoor spaces. This can significantly impact the quality of recess for students in these schools. Next is the academic pressures. With increasing emphasis on standardized testing and academic performance, some schools may be tempted to reduce recess times, and we've seen it all over the state. And this approach, however, can be counterproductive given the benefits we've just discussed. Also, we see disparities in physical accessibility. So not all playgrounds are designed to accommodate students with physical disabilities. And this can feel very exclusionary and have students feeling like they can't fully participate and be a part of their school community. Lastly, there are cultural and social barriers. So some students may face bullying or social exclusion during recess, while others may come from cultural backgrounds where certain types of play may not be encouraged. So some strategies to consider when working with schools on equitable access to recess are inclusive play designs. So these involve creating playground spaces and equipment that can be used by all students, regardless of their physical abilities. There's professional development for staff that is very crucial. Teachers and recess supervisors need training on how to facilitate inclusive play and address issues like bullying and exclusion. Flexible recess scheduling can help ensure that all students get adequate recess time, even with differing class schedules and academic needs. There's also the social and emotional component that needs to be addressed. This might involve implementing programs that promote positive social interactions or providing additional support for students who struggle socially. Equitable allocation of resources is absolutely essential. How's all this going to get paid for? So that means that ensuring that all schools, regardless of their location or their socioeconomic status of the students, have the funding and resources needed for quality resources. And so I'd like to pass it now to my colleague, Vanessa, to go into what PSC changes.
Thank you, Andrea. I could hear you talk all day. You got me sold on recess policy. So our work over the past few years has really evolved to take a focus on policy systems and environmental change. And the reason for that is because it's a great way to address community health needs by changing an individual's surroundings so that making the healthy choice is the easier choice for the individual. And so when we're talking about policy changes, that can look like laws, ordinances, regulations. It could be formal or informal. So a lot of what we'll talk about during this presentation is our recess policy, and that's like a very straightforward example. Systems change are a little bit less direct. And so these impact all areas of the organization, the institution, or the community. And they're not just policies, it's how organizations are working together or how departments within the organization are working together, right? And then environmental changes can involve changes to the economic, the social, the physical, or the financial, or economic environment. And so that can look like maybe a bike rack to make biking more accessible to schools, but that can also look like accepting SNAP and WIC benefits at the farmers market. Slide. So at Healthier Texas, a lot of our work is centered on building capacity for our schools to implement policy systems and environmental change projects. And so we use the WISC model, whole school, whole community, whole child framework. And we're really trying to bridge the gap between what the school's determined health needs are, what their goals are, and available resources. And through various different tools that I'll go over in the next couple of slides, we really are essentially just providing our school partners with the structure, the direction, and the resources so that they can lead policy systems and environmental changes at the district level. Slide. So the first tool that we use is the School Health Index. This is developed by the CDC. And essentially, this is looking at research-based guidelines for school health. And it's looking at school health and safety programs and policies and identifying what are the strengths for the school, what are the opportunities for growth for the school. We use a modified version of the School Health Index that focuses on a little bit more of that physical activity and nutrition aspect. But there are traditionally 10 components. All of the components of the WISC model are covered in the index. Slide. And so once we work with our schools to determine where are the strengths, where are the opportunities, we will work with our school partners to create a school health improvement plan. And so this is essentially just a roadmap that's going to help the schools establish those changes that are going to help address the needs. We create SMART goals with them, and we have activities, timelines. We identify who's the school lead, and then we help the school through the implementation process. And so sometimes that just looks like accountability, like, hey, where are y'all here? And then other times it's a lot more involved, like maybe they need access to funding or resources, or maybe they need to connect with a professional in a certain subject matter area, or maybe they need help creating plans or SOPs, like procedural documents. And so our team, and shout out to my team, who they work so hard, and none of this work would be able without them. And they are essentially just consultants for the schools, and it takes a lot of relationship building, a lot of work to get to the point where the school wants to work with us for these PSE changes. Slide. So these are the 8 schools that we worked with last year in the Rio Grande Valley. So we worked with all 8 of these to create school health improvement plans. Last year, 2 of our SHIP schools, Harlingen and Brownsville, were able to pass recess policies. And then 2 of our schools this year, Donna ISD and Point Isabel ISD, are just crossing that final step. And in the next few weeks, we should be able to count them as having recess policies adopted into their local school wellness policies. And so, you know, like I mentioned, our role with the school is really to help give them guidance. The school is doing all of the work. We're not petitioning the school board on their behalf. We're giving them maybe talking points, helping them to organize parents or organize community members so that they can have those conversations. And so it's really important for me to mention here that while these are schools that we work with, the schools are doing so much of this work, and we have great partners in the region that are also key and critical to this work being done. Slide. So as with anything that will create a huge impact, there's a lot of barriers we face. And so really, I think one of the biggest one is that there's just competing priorities. The idea of taking away time that should be spent for academic focus or for prepping for STAR testing is like really difficult for some educators to wrap their head around. And like we mentioned before, there's a lot of evidence to suggest that recess is going to improve test scores, is going to improve grades, but it's just not something that people are really aware of, and it's just a fear. There's also limited resources with our schools. You know, there are funding constraints that almost all of our schools are facing, staffing issues, staff turnover at our schools is really high right now. A lot of our schools have space limitations. There are schools in Texas that don't have outdoor play areas, or indoor play areas should the weather, be non-permitting. And then there's a lot of cultural perception issues. I think there's this big culture of, especially in the US, where it's like more study time, more study time, more study time. And the idea that recess is unproductive and that time could be used better studying or practicing for whatever. And another big issue that we come across, and this is probably the second most common, is behavioral concerns. So not only are we encouraging our schools to, we're recommending at least 30 minutes of unstructured playtime, but we're also recommending that they no longer remove recess as punishment. And that's a kind of a hard, it's a big change, because that's been something that educators have felt like has been an effective tool. And the data suggests that this unstructured playtime will actually help with behavioral issues that students are facing. So it's a little bit counterintuitive. And so that's another big issue that we have to tackle through a lot of education. And then there's just a lot of resistance to change. And we encounter that a lot with our schools that have, very seasoned educators, and they've been doing things the same way for a long time. And so that's just going to be something that we'll have to encounter and be prepared to face at every school that we're working with. So,
Thank you, Vanessa. And so, as you can hear, it's been a lot of work with our team here to get schools on board to understand the benefits. So there's been a lot of education that has to go into educating schools around the benefits of recess, and even just gathering the right personnel to make sure that the right people are at the right table, right? But let's talk about how we develop these effective policies. So a model that our team has worked on and is refining, and that we've seen some best practices happen while working with our schools. And so, as you can see, it's kind of a four-step process that guides our approach. And so first, we start with the research, and this is where we're building our knowledge base. So when you're working with schools, and trying to have them understand the benefits and why we need to create the policies, we really need to dive into the latest studies on the benefits of research, examine some successful policies that have been implemented within districts in their area, and even gather some specific local data. And so this really ensures that the policies are grounded in evidence and best practices. Next, we organize. This is where we assemble our team. Effective policy, it's not a one-person job. Believe me, we've been to schools where we hear it's the principal or just the superintendent really guiding some of these plans. And we know that that is not an effective approach for them because it limits their capacity. So we need to bring together a diverse group of stakeholders. So teachers, administrators, parents, health professionals, members of the school health advisory councils, but even students when appropriate. And so we know that each perspective or each brings a unique perspective that shapes our policy development. The third step, and this is probably the most in-depth portion, but it's the planning phase. This is where we develop our strategy. So using what we've gathered and learned from our research and the input from the team, this is where we'll begin to craft this comprehensive recess policy that addresses the specific needs and challenges of our school districts. And finally, we move into the action portion where we implement our plan. And this involves rolling out the new policy, training staff, making necessary changes to schedules for the environment, and setting up systems to monitor and evaluate the policy's effectiveness. And so remember, this isn't a linear process. In developing these policies, we may need to cycle back to earlier steps to learn and adjust. But the key is to maintain that flexibility while staying focused on the ultimate goal. And that's creating a recess environment that supports student well-being and development. And so some of the successes that Vanessa mentioned that have come out of our work are the 2 recess policies that have been passed. We've had installation of 3 playground shade structures to support environmental change. And we have the creation of our recess policy toolkit, Recess Ready. And so we're really excited for that to come out. Please keep a lookout on our website, healthiertexas.org, for when we post that. And it's just been a really, really exciting time. And here at at Healthier Texas, we're excited to see what more can come from our work. And these successes show that with the right approach, we can make significant strides in improving recess policy and practices in our schools. And so we have to remember that every step we take towards better recess policies is a step towards a healthier and happier and a more successful student. And so we really like to open it up to questions for the audience, if you have any.
All right, thank you so much. Does anyone have any questions? You can feel free to put it in the chat or come off of mute and ask your question. Don't be shy. I know there's at least one question out there. Maybe I'll just popcorn people and see if random people have questions. Just kidding. I wouldn't do that to anyone. I won't put you on the spot like that. All right. Well, thank you, Andrea and Vanessa, for being here. Is there anything else that you wanted to just let us know about? Oh, let's see. There's one question coming in. Carlton asked, did you work with PTOs at all to help implement your work?
Yeah, that's a really good question, Carlton. So our main partner within the school is actually the School Health Advisory Council. So the SHACs are who we work with, but a lot of times that there is a lot of overlap between who's on the PTO and who's on the SHAC. But that's not to say that we don't work with the PTO in other capacities. So although the SHAC is kind of like our primary planning partner, we will reach out to our PTOs or our other parent-led groups that will vary across districts when we need to gather parents that we need to advocate for the cause, or if we want parents to write letters or attend meetings or to just give their input. A lot of the pre-work that happens when we're trying to advocate for the policy is we're trying to get testimonials from parents, from students, that this is something they value, this is something that they want, because nothing drives change faster out of school than a very vocal parent. And so that's something that we're always trying to incorporate parents in any capacity we can throughout this work.
Thank you for that. That was extremely helpful. And yeah, I get that. And just a quick follow-up question. Were the SHACs that you worked with, were they district wide, or were they just I guess school based?
Yeah, that's a good question. So our work last year and this year is primarily focused in the Rio Grande Valley region. And so the school districts that we work with vary in size. So we have some itty bitty districts that are one elementary, one middle, and one high school. And then we have some very large districts, nothing like big like a Fort Worth ISD, but some pretty large districts. All of the districts we work with, we're working with the shacks at the district level. I'm aware that there are some schools, especially some bigger schools, that have like shack equivalents at the campus level. We haven't worked with any of them, but we would be open to that. And then another thing I want to add, Carlton, and I think this is really an important thing to say, is that the schools that we work with, their shacks were all at really different levels of like functionality. So we have some schools where they've got really great high performing shacks that have a lot of engagement from community, from families. And then we had a few school districts that did not have shack meetings and had not had any shack meetings since before the pandemic. And so one of the most important things is we need a really strong shack to be able to advocate for any kind of policy systems or environmental change. And so for some of our schools, that required starting at step one and really developing their shack so that they could be in a place to advocate for these kinds of policies.
Thank you for that, and thank you for your questions, Carlton. Thanks, Vanessa, for explaining that as well. Anyone else have any additional questions for our group? Going once. Going twice. Oh, okay, here we go. I know it's a fast type. So how have you addressed any negative feedback to creating policies or procedures to keep recess time precious, quote unquote precious? So negative might be a little less intense of a descriptor here.
Yeah, that's a good question. So, I mean, I think it boils down to understanding what the hesitations are. And so primarily the hesitations when it comes to like the time are that it's taking away from academic time. Students need more time for STAR testing. And so I think that there is flexibility there. I think gold standard, we want our schools to have at least 30 minutes of recess. But sometimes that's not possible. And so some of our schools, the policy is 15 minutes or 20 minutes. And that's a good start so that we can at least get the systems going and get everything in place. So that way we can work up to like a 30-minute recess. And so I think there's like a combination of trying to meet people in the middle, but also helping them understand the data that suggests like the students are going to perform better. They're going to have all these benefits. And then one really interesting little anecdote is we had one of our schools where one of the points that kind of helped change some opinions were taking that frame of the benefits for teachers and educators, right? Because the students are outside playing, that means there's also going to be usually like an open like time frame so that teachers can kind of decompress a little bit. And then in some instances, there's time that requiring the teachers to be outside. And we all know the benefits of being outside on our mental health and our stress levels. And so I think that it's really important that we are considering the educators, what their concerns are and how this could potentially impact them positively.